Many professional athletes are prone to hamstring injuries, which range from minor strains to total rupture of the muscle. They're caused by excessive stretching or tearing of muscle fibers and soft tissues. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today, we visit with Dr. Rhonda Boschron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about hamstring injuries.
Symptoms can be as minor as irritation at the back of the leg to as extensive as a rupture where there is bruising, pain, and debilitating discomfort where the athlete cannot walk. Minor symptoms will be in the form of pain and inflammation. Usually there is difficulty in squatting or sitting positions with a hamstring injury. Treatment usually involves modalities to help the spasticity of the muscle, the inflammation of the muscle, and help to repair the muscle group or the tendinous insertion point. Also, treatment will involve rehabilitation as well as short periods of rest if needed.
The first thing to do is your RICE, right? Rest, ice, compression, elevation, right? To get this tissue calmed down. To get rehabilitated or actually from reducing the incidence of it happening again. Several important things to consider. One, when a muscle gets strained like that and bleeds and tears, it repairs itself by forming a little bit of scar in the muscle. So stretching, a very important part of the rehabilitation of that muscle. We're going to go right to an exercise, a correct way to stretch the hamstrings. Sandy's here to demonstrate the stretch to the hamstrings. Again, this is called the long sit position. One foot is over the edge of the table, or if you're sitting on two chairs facing each other, it's on the floor. Again, the knee is kept straight and the foot is slightly pulled up. Tall, nice tall back. She's going to move all from her pelvis, keeping a nice tall back. Yeah, and then back up again. You want to hold that stretch for 30 seconds on, 30 seconds off. Do it 4 times. And you can do it up to 4 times a day. Get 15, accumulation of stretching is always beneficial. And come back off, right? One of the dangers you don't want to do is to tuck your chin, because this is curling up the back, which is not a hamstring stretch. It's a stretch for the low back, right? So again, nice tall position, slight bend forward until she feels a pull, and you hold that stretch 30 seconds on, 30 seconds off. Do it 4 times a day. The 2 important hip muscles to strengthen are the deep external rotators and the abductors. We're going to go right to those videos and show those exercises. This is an easy exercise really to do. And he's going to be, again, 90-90. So the hip is at 90, the knee is at 90. And again, if you are really weak, you won't even be able to put a weight on the end of this ankle. But he's going to bring it down as low as he possibly can, and then he's going to come straight up, Chris, as high as you possibly can, right? You want to avoid trying to bend the knee, because we don't want to get the hamstrings involved. We want the deep hip rotators. Find a weight that you can only do 6 or 8 reps with in 3 sets. Work up to 12 reps, 3 sets, or 15 max reps, 3 sets, and then drop back down to 6 or 8 and add more weight to continually stimulate that muscle to grow. The hip extensors and the hip abductors, and Chris is going to get both with this exercise. As you can see, he goes back into extension and then lifts his leg up. And then you just take a weight again, put it around your ankle, and he's going to slowly lower it down, right? To the count of 10, and then come on back up again. Again, you find a weight you can only do 6 or 8 times, a couple of sets. You work up to 12, 15 max reps, 3 sets. Then the muscle is strong enough that you can add more weight. Drop back down to 6 or 8 and add more weight and progress that way, constantly stimulating the muscle to grow. Lastly, what we have to focus on is balance again. These reflexes to coordinate the muscle with the ligaments firing and the tendons. And I'm demonstrating those on a nice video we're going to see now. Stand on one leg. This is on a hard surface, no shoes, and you should be able to stand in that position without swaying for 20 seconds. Now we're going to do it with the eyes closed. So you're going to stand on one leg, get your balance, and close your eyes. By the way, you should do it on both legs. One with your eyes open, one with your eyes closed on a firm surface. And then Dave, pull that piece of foam over. Now this really brings in more difficulty because we're actually taking the sensors underneath the foot and we're kind of fooling them by being on a soft surface. So now you're more relying on your vision and your inner ear. Good, Dave. Now balance on that with your eyes open. And again, you should be able to balance for 20 seconds without swaying or doing those gyrations to keep you up Last test is with your eyes closed, and this one you're going to see a lot of you guys and ladies out there going to fall over like Dave just did.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.